Hello everyone, welcome to our presentation. My name is Yetunde Fadipe and with me I have Alison Kane and Jacob Burnett. We'll be making a presentation on Second Harvest Food Bank of East Tennessee OrderAhead Implementation and Evaluation Project Spring 2022. We would like to acknowledge Dr. Spence, our faculty advisor, Courtney, the Nutrition Access Program Manager of the Second Harvest Food Bank of East Tennessee, Eileen, the Agency Relations Coordinator of Second Harvest Food Bank of East Tennessee, and Diane, the OrderAhead Program Manager of Feeding America. Thank you so much for your wonderful support towards this project. Here is an overview of our presentation. We'll be starting with the background, intervention plans and methods, the results, discussion, and conclusion, and also we'll be showing you our logic model.
So like Yetunde said, first we'll start with some background on the project. As many of you may already know, Second Harvest Food Bank of East Tennessee is a nonprofit food bank within the Feeding America network. Second Harvest serves 18 counties across East Tennessee, including Knox County, which is where our implementation took place. And since being founded in 1982, Second Harvest has distributed over 21 million pounds of food to those in need. As a food bank, Second Harvest operates by collecting food and monetary donations from the public and other organizations. Donated as well as purchased foods are then distributed from Second Harvest Warehouse in Maryville, Tennessee to local partner agencies across their service area, which can include dedicated food pantries or pantries located within churches or shelters. Those partner pantries do most of the direct distribution of food to individuals, who Second Harvest refers to as neighbors. So you'll hear us use that terminology throughout this presentation. But in addition to partner pantries, Second Harvest does also operate their own food distribution events, which include mobile pantries and now some direct distribution events from the warehouse itself. In fall of 2021, Jacob, Yetunde, and I conducted a community needs assessment along with field advisors from Second Harvest. The key findings of our assessment include that neighbors using Second Harvest services currently don't have a whole lot of choice in exactly which foods they receive, which can lead to dissatisfaction and food waste if they aren't able to use the food they receive. Secondly, our assessment survey at 2 Knox County partner pantries showed that neighbors are especially interested in receiving more fresh fruits, vegetables, meats, and cheeses. We also found that 60% of the neighbors we surveyed reported being concerned about cardiovascular health conditions like heart disease and high blood pressure for either themselves or for their families. And this suggests that heart-healthy foods and related education may also be helpful for neighbors. And finally, we saw firsthand that Second Harvest partner pantries vary widely in the level of client choice that they offer for food selection, as well as in their operating hours, eligibility requirements, and other procedures like how frequently they can be used. And this can understandably be frustrating for neighbors who need food assistance but aren't sure how to access it. And as a quick refresher on the client choice model for food pantries, this is considered the gold standard, where neighbors are able to choose which items they receive, often in a setting that looks more like a grocery store. This method is preferred by Second Harvest and Feeding America because it's been found to reduce stigma, restore dignity, and prevent food waste. The COVID-19 pandemic has made offering client choice more difficult, though, as pantries are trying to cut down on contact to prevent the spread of disease. As a result, new tools are being developed to facilitate client choice while continuing to reduce the necessity for face-to-face contact. Which brings us to OrderAhead. OrderAhead is an existing website developed by Feeding America that allows users to custom order food packages for pickup at a set time and location from food banks and pantries. Think Kroger ClickList, but for food pantries. And this helps give neighbors that increased level of control to choose exactly which foods they want from a selection of what's available, which they can customize to meet their personal preferences as well as health needs. OrderAhead reduces stress and breaks down some of those barriers to food pantry access by giving neighbors an easy, convenient way to place orders with their mobile device or computer. And best of all, OrderAhead is completely free to use by food banks within the Feeding America network, including promotional materials and tech support. The website is still in development, so it can be a little glitchy on the back end, but new features are actively being worked on to make the ordering process even easier for both neighbors and food bank operators. And when neighbors visit OrderAhead.org, they'll reach this page. By clicking Get Started at the bottom, they're prompted to enter their zip code, which will connect them to the food bank that serves their area if that particular organization is set up on OrderAhead. And this is what OrderAhead looks like once you're forwarded to your local food bank's page. This landing page shows a quick view of categories of food offered along the top of the screen, as well as short blurbs about qualifying and how the service works. Once neighbors begin building their order, the website prompts them to pick a location and pick up time, which can be fully customized by the food bank. So to break it down step by step, neighbors are able to browse the website for the available inventory, which are listed by category, such as canned vegetables, dried beans, or pasta. Neighbors are prompted to choose the pickup time and location before they start adding items to their cart. And once all the desired items are added to the order, neighbors can review the eligibility criteria and confirm that they qualify. If they already have an account, they'll be prompted to log in. Otherwise, they'll need to create a new account. And then the order can be officially placed, and the neighbor receives an order confirmation through their choice of either text or email. And lastly, all the neighbor has to do is show up at the scheduled time and place with their order confirmation to pick up their custom food package. And one last piece of background information before we move on to our intervention plan. Fresh Pantry is a monthly mobile food distribution event that's operated directly by Second Harvest. Fresh Pantries happen on the third Saturday of every month at the Western Avenue Cherokee Health Systems location in Knoxville, Tennessee. And it was created with a focus on providing fresh fruits and vegetables, dairy products, and meat, along with some shelf-stable foods. There's currently no client choice available at Fresh Pantry. It operates in a drive-through format with neighbors receiving pre-packed bags of food. Because it's fully controlled by Second Harvest with a focus on providing the types of fresh foods neighbors expressed the most interest in receiving, but it currently has no client choice, Fresh Pantry was chosen as the pilot site for the implementation of OrderAhead. And now onto our actual intervention plan and methods. Initially, our plan was broken up into 3 main implementation parts with an evaluation step at the end. The first part was to obviously make the OrderAhead website functional for use by Second Harvest. Second, we wanted to spread awareness of the availability of OrderAhead by distributing flyers to neighbors at the March 2022 Fresh Pantry, with the aim of allowing neighbors to place orders for the following month in April. And once orders were placed, we would assist in packing and distributing them directly to neighbors at the April Fresh Pantry. We also plan to evaluate neighbors' satisfaction with using the OrderAhead service through a survey that would be integrated into the website's ordering process. Therefore, our ultimate goal for this project was to provide neighbors utilizing the Second Harvest Fresh Pantry mobile food distributions with a user-friendly method of custom ordering food for pickup. And our process objective was to administer a survey to determine whether OrderAhead was easy to use and if neighbors were satisfied with their experience placing an order. Our impact objective was to establish Second Harvest presence on OrderAhead so that it can be used by the neighbors they serve. And finally, our outcome objective was to start the process to expand OrderAhead for use across more counties served by Second Harvest in East Tennessee. So then what actually happened with our intervention plan? Well, I've broken it down into the good and the not so good. We definitely got firsthand experience with the amount of flexibility required in community nutrition while working on this project. On one hand, we were able to successfully make contact with Feeding America and had several meetings with Diane Wertz, who is the OrderAhead program manager. We were ultimately able to set up Second Harvest website on OrderAhead, and we learned a lot about how the platform works, and as well as some really interesting avenues for future expansion. We were also able to enter some inventory provided by our Second Harvest field advisors. But on the other hand, although our field advisors are so excited about this project, Second Harvest just was not ready to roll out OrderAhead at the April Fresh Pantry as we had planned. And this was due to unforeseen setbacks on their end. So it didn't make sense to hand out the advertising flyers in March either, of course. And we as the implementation team also ran into technical issues with the website, which is to be expected as it's still in development. Entering inventory became a very slow process due to glitches, which limited the amount that we were able to input. And of course, as a result of all of this, no neighbors were actually served by OrderAhead as part of our implementation. But we did have the opportunity to serve lots of wonderful neighbors using the more traditional methods at the April Fresh Pantry. Once we learned that Second Harvest wouldn't be able to pilot the program in April, we worked with our field advisors to significantly change our methods. First, we rehauled our survey since neighbors would no longer be able to give us feedback on actually using the OrderAhead service. Instead, we approached neighbors while they were waiting in line in their vehicles at Fresh Pantry and directed them to the OrderAhead website. We instructed them to trial the website and look around, but that any order they placed would not actually be fulfilled. And after neighbors went through the drive-through line, we did our best to catch people for the new survey to evaluate their satisfaction with the OrderAhead concept. However, we did face even more challenges with evaluation for this project. First, we were not able to offer any sort of incentive for participants in exchange for their time spent answering survey questions. We had coordinated with our Second Harvest field advisors about obtaining $5 or $10 grocery store gift cards, but on the day of Fresh Pantry, we learned that the only gift cards Second Harvest had access to were very large denominations that could not be broken up. And by that point, it was too late to get any other gift cards. And as a result, many neighbors declined to complete a survey, even though they were interested in the idea of OrderAhead, which is fair considering they wouldn't receive any compensation for their time. Additionally, this was a record-breaking distribution with 329 total households served, but there weren't enough volunteers on hand to handle that volume. And that meant that although we were technically there for the evaluation of our project, we jumped in to help pack bags and load them into neighbors' cars, because ultimately the most important thing was making sure that our neighbors were fed. And finally, many people who agreed to complete the survey after we talked to them in the line were not actually surveyed because they either changed their minds, they forgot, or they weren't spotted by us before they drove away. So in the end, we administered our semi-structured survey using an online form through Qualtrics to 11 neighbors in total. The data we obtained were analyzed using Qualtrics and Excel, and now I'm going to pass it to Yetunde to talk us through the results.
Now let's take a look at our results. So we asked the neighbors how easy it is to use the website, and we found out that 100% of the neighbors found the website easy to use. We had other options, but we got no response from them. Our other options were neutral, disagree, and strongly disagree. So that was why it wasn't included in the figure. So we asked questions if the foods on the website meet the health needs of neighbors, and our results showed that the majority of the neighbors agreed that the foods provided on the OrderAhead website meet their health needs. Also, we asked the neighbors how much they agree that the foods on the website meet their cultural needs, and we found that a majority agree that the foods included on the OrderAhead website meet their cultural needs. We asked the neighbors questions on what they like best about using the website, and we got responses like it was easy and convenient to use, it ran smoothly, they were able to choose foods that meet their health and cultural needs, it was user-friendly, it reduced waste of food, and also they were able to include a pickup time. And they all agreed to place pantry orders for pickup using the website in the future. Questions was also asked if access to OrderAhead will help them or their household increase the amount and quality of foods available. And we found that the majority of the surveyed neighbors responded that access to the website will increase the amount and quality of food available in their household. We also asked if they feel that access to the OrderAhead website will help them and their household reduce the amount of money they spend on food, and our results showed a large percentage agreed that access to the website will definitely reduce the amount of food, the amount of money they spent on food. We asked if the neighbors are interested in free meals kits created by a registered dietitian for pickup through the OrderAhead website, and our results show that almost all the participants are interested. We asked questions about the nutrition-related health concerns neighbors have for their families, and this includes heart diseases, diabetes, high blood pressure, obesity, and hypercoagulation disorder. I'll be passing it to Jacob to continue with the discussion.
Okay, I want to restate the objectives mentioned before so we can have like a better context if we accomplish them or not. And so for our process objective was administer a survey to determine ease of use and neighbors' satisfaction after placing an order. We determined the feasibility based on the 11 people who did our survey. However, our survey could not improve as the website develops and is implemented across all pantries across East Tennessee. There are discussions about wanting to issue the survey on the website after a neighbor orders their food. For this piloted approach to testing feasibility, we accomplished our process objective by having neighbors interact with the website. For our impact objective, establish Second Harvest Food Bank's presence on the Feeding America OrderAhead platform for use by neighbors. This objective is continuing development. Eventually, Second Harvest's vision is to develop this service as an online ordering system that will turn to each meal into recipe boxes and to have instructions on how to cook each box. And where this is like one thing we can do, we still want to have that option of like just having food provided at a certain time period for neighbors to pick up. And we can continue to work on the website to focus on maintaining those time slots for pickup and choosing the list of foods in our inventory. And for outcome objectives, expand the OrderAhead platform across more counties in Second Harvest Food Bank's service area. We cannot accomplish this ambitious objective within a time frame of a semester. However, this is a feasible objective that may be able to be completed within this year. Flexibility will always be a key in community nutrition, and dates and times may constantly change for implementation. And now, to discuss our strengths and limitations, there are multiple for each one. In considering the strengths, we are grateful to have the assistance of Second Harvest and for allowing us to help with their Fresh Pantry event in April. It was a low-cost measure to assist with improving food preferences by going more toward an online approach. It is going toward a sustainable system by reducing resources involved with paper use and hopefully reducing food waste. With our community assessment performed last semester, we discussed how there are so many outcomes that could allow people to have food preferences at food banks. One of them is to reduce food waste. Another one is to increase food security and impact sustainable means to the community. And our limitations are shown. One of them is how low our sample size was. When we went to the event, it was unrealistic to think that we could have spoken to 300 neighbors. The entire system consisted of a drive-through approach and following a line of cars for food distribution. We had to consider the time the survey took while people moved through the line and to not hold up traffic on their way out of the parking lot. In terms of the website, we had many setbacks due to the website itself. On the neighbors' side, the website worked very smoothly. However, when inputting the inventory, it continued to glitch and it continued to freeze. And all the Mac users may be familiar with the spinning beach ball when pushed to its limits for whatever program that they're working on. And this is what my computer experienced when I attempted to input the items. However, we were eventually able to input the correct items. And kind of thinking about how we can improve, there are a lot of different ways, and we can improve to include larger sample sizes. 11 is better than none, However, this leaves room for future studies to implement more surveys, and we can compare them to the results we had the first time. With that being said, we could look at different food pantries that will further assist in collecting data for the feasibility of the online ordering system. Our assessment last semester revealed that the data collected from the 2 food pantries have different opinions, desires, and needs for their food preferences. And we also need more volunteers that assist in gathering survey data. Eventually, we want to implement the survey into the online ordering system. But for our sake, if we had more volunteers to issue the survey, we may have been able to collect more information from neighbors. Our last area of improvement is including incentives. A few neighbors refused to do the survey, and we may have been able to motivate more by issuing such incentives as grocery store gift cards or things of that nature. Overall, we want to stress the learning opportunity for the entire process. Things do not go as planned. However, we could still establish a framework that can continue to be worked on in the future. And in any case, we were able to volunteer and issue food to our neighbors. And that is our greatest takeaway, is being able to pitch in and provide for people. With that in perspective, our most minor concern was getting large amounts of surveys, while Second Harvest needed people to give food out to our neighbors. Now, these are our conclusions that we made for the entire intervention. We have concluded the implementation of using OrderAhead as a feasible option for a mobile food pantry. From this point, we should be able to develop education materials for each meal box. We want to acknowledge the health issues we have addressed in our community assessment, primarily involving non-communicable diseases like heart disease and diabetes. We also want to continue to gather information on neighbors with food allergies. And for the past 2 semesters, we have not been able to collect this information due to the limited sample sizes of our surveys. We want to make sure every neighbor gets the food they want as efficiently and as safe as possible. Eventually, we want to expand this ordering system across all East Tennessee food pantries and offer free meal kit boxes through OrderAhead, while also being able to provide just the easy, like you pick a time to go to a pantry and able to pick up your food, and just able to add on to the efficiency. And it may be comparable to such ordering services as HelloFresh and Blue Apron. And HelloFresh is like an ordering system where food boxes can be ordered with ingredients and cooking instructions. And this was like the idea from the registered dietitian at Second Harvest Food Bank, was to include something like this, where she could provide recipes and even like cooking instructions and videos of being able to help neighbors with their foods. And this is very feasible because of the feedback about wanting to try new recipes and being able to be provided materials now how to cook their food, because there were so many neighbors that wanted to be able to try new recipes or to be able to learn how to, or to be better with cooking in general. But that is a bunch of our conclusions, but we'll now show you our logic model that has kind of helped with our entire project. And this represents our process of where we were and how we could bridge the gap toward our outcomes. And the model shows our resources, the activities that we performed, and the expected outcomes. And these are our references. And thank you. We'll be able to have a live question and answer via Zoom on May 12th at 3:30 p.m. and also on May 18th at 1 p.m. But we'll be very happy to answer any questions that you all will have. And thank you for letting us present to you about the results, and we're very excited to see how this project can further increase and help the needs of our neighbors and being able to provide safe and efficient nutrition to our community.